I just want to quickly respond to something that Chairman Pallone mentioned in his opening statement. He referenced a Department of Labor finding that insurance companies are out of compliance with a law that requires them to deliver parity for mental health benefits, and we all want that. But it's true that all the comparative analysis were initially insufficient, But my understanding is that the DOL has yet to give plans the guidance they need in order to be in compliance. And it's not just me. Secretary Walsh agrees. The Department of Labor has said they will issue a notice of proposed rulemaking to provide that additional guidance to payers by July of this year. The need for this guidance is acknowledged in the very report that the chairman referenced. I look forward to reviewing the new regulations before concluding that the current authorities are intentionally insufficient, that they're trying. I hope. If they aren't, we'll have to do something. Dr. McCants-Katz, there's been a lot of discussion among members of our committee about the mental health of school-aged children. That said, there's not been nearly as much conversation in the public discourse about the impact of COVID-19 restrictions on younger children and babies, but I'm seeing growing evidence that their cognitive development may be affected by prevalent use of masks by caregivers, as is likely to be the case for babies and young children spending their days at daycare or preschool. What is the role of face-to-face interaction in the normal development of infants and toddlers?
So from the time that a baby is born, they make facial recognition with their caregivers. It's important to attachment between the caregiver and the baby. Babies learn facial processing, so they learn to recognize who their caregivers are. And they, from a very early age, start with social and emotional development that is based on interaction, being able to look at the face of the caregiver and the caregiver at the face of the infant. I think it would be important to educate parents and caregivers about the need to interact with these very young children without masks. I know that we now have rapid testing available. We can use rapid testing to assure that the risk of COVID is very diminished, but it's important that that families and caregivers in daycare centers, for example, and nurseries be able to also interact with babies and young children without masks.
And isn't it true, it's not just the interaction and knowing that the folks care for them and seeing those facial expressions and that's very important, but isn't it also true that it affects their ability on verbal skills and motor skills and overall cognitive skills when the people that they're with a big part of the day are masked?
Yes, it's a concern. There is emerging research that indicates that children born during the course of the pandemic, when compared to children born earlier, have those kinds of deficits, and it's something that I think is not fully understood, and the literature is young, but we need to pay attention to that. It could very well be something to be concerned about for our children.
And Dr. McCants-Katz, you referenced hybrid telehealth, and we all know that telehealth has been important during this, but you referenced hybrid telehealth, and I think I know what that means, but can you tell the folks back home, what does that mean, and why is that important that we have that?
What I'm recommending is to keep telehealth in place, but to make it available in a number of ways. So when CMS defined telehealth, originally they talked about audiovisual platforms. Well, millions of Americans don't have access to audiovisual platforms. They either can't afford to have an internet connection in their home, or they live in rural areas. And it's estimated about 25% of Americans living in rural areas do not have broadband access. And so the telephone
And they need contact. There you
important.
go. Look, that's a lot of people in my district, and I'm running out of time, so I hate to cut you off. I'd love to have more discussion, but that's a lot of people in my district, so we need to make sure it's not just the audio and visual, but also the audio, so that people can at least have somebody they can talk to when they're having mental health issues. I appreciate that. I will say we also need more on substance abuse, and I want to commend Delegate Sam Rasool, who is leading the charge he's just outside of my district, but leading the charge in my district for expansion by the state of Virginia at the Catawba Hospital for substance abuse disorders, and I appreciate that, and I yield back, Madam Chair.